and welcome to the fourth and final episode of this interview series, Cat to Vet Tales, where I've been chatting with feline experts all about how we can keep our cats happy and healthy. I hope you've been enjoying this as much as I have. We've had some pretty incredible conversations. If you've missed any, please check out kittenlady.org/catology so you can catch up on all of them. Thank you again to Royal Canin for partnering with me on this series and on the Take Your Cat to the Vet campaign. I feel really inspired. I hope everybody is feeling inspired to stay curious about their cat's health. And I have a really exciting guest this week. We're going to be talking about the health of newly adopted kittens. I'm very pleased to have Dr. Ron Cammarata on this show today. He's an incredible veterinarian. He practices here in San Diego at Cabrillo Pet Hospital. And he is actually the veterinarian who treats my personal cats as well as the kittens from my nonprofit, Orphan Kitten Club. Dr. Cammarata not only works at Cabrillo Pet Hospital, but he has also been working with the San Diego Humane Society for over 10 years. So he has an incredible wealth of knowledge about kitten health, and I'm so excited to have him here today to talk about that. So thank you so much, Dr. Cammarata, for being here with me.
And thank you, Hannah, for having me, and hope I can provide some good advice for all your kitten followers.
Yeah, absolutely. Well, it's great to have you because you are an amazing resource locally for us. I wanted to start by asking you, obviously the kittens that we're adopting them out with as much veterinary care as they can have at that age. And when people adopt a new kitten, they might be under the impression, well, the organization said this is a fully vetted kitten, so I probably don't need to take them to the vet, right? Can you talk about why, even when you adopt a kitten who came from an organization and has seen a vet and seems healthy, why should people still consider taking them in for a first kitten checkup at a vet?
Well, one of the most important things is vaccines. They have to go through a series of vaccines. And the reason being, people may have a little understanding of vaccines now with COVID and their own vaccines. And we and animals, we make antibodies to help protect ourselves. And babies, human babies, all animal babies, they get initial antibodies from the mother through their milk. And those antibodies protect the babies, the kittens specifically, somewhere up to 8 weeks, even up to 16 weeks. And while those antibodies are protecting the babies, they cannot produce their own antibodies to protect themselves. And so we repeatedly vaccinate them until at some point those antibodies run out and the baby kitten can produce their own antibodies and make their own immune response. Unfortunately, it's different from each kitten. So that's why we have to vaccinate them repeatedly.
Mm-hmm.
Another good one. Yeah, go ahead.
I think it's something that a lot of people don't realize because, in the case of, say, adopting like an 8 or 9 week old kitten, you might be adopting a kitten who has had, 1 or 2 vaccines. But people are surprised when you tell them, yes, you're adopting a healthy and vaccinated kitten, but there's still an expectation that you need to bring them in for further vaccination.
Yeah, and it's not the number of vaccines they receive. It's the age where they received the last vaccine. So if a kitten had even 3 vaccines, by 10 or 12 weeks old, they still need 1 more, all the way through 16 weeks old. If they get started later, okay, then they might only need a set of 2 or so, but all the way through 16 weeks old.
Yeah, and I know that vaccination recommendations for kittens can be different depending on whether it's like a personal pet who's not exposed to other animals or if it's in a rescue setting. What are your recommendations for people who have newly adopted a kitten? What age do you start? And
we'll start them as early as 6 weeks, but most of the time we're starting them at 8 weeks because getting taking a kitten away from its mother at 6 weeks is a little too early. They actually learn a lot of good behaviors from the mother and the other kittens in the litter. So normally we're starting them around 8 weeks old, and then we'll see them every 3 weeks until 16 weeks old. And each time they'll get a vaccine.
Right, but might be different if it's like a foster or shelter setting.
Yeah, in a shelter setting and foster settings, a lot of them will vaccinate almost every 2 weeks to make sure we don't miss that window of protection. Yeah, because we have higher exposure rates to some of those contagious diseases.
Sure. Yeah, so vaccination is one really important reason to go see a vet. Are there other things people should be considering, even just establishing a good relationship with a vet so that...
For sure. So super important. So one of the most important things is your physical exam, checking your little kitten out by your veterinarian. So just like, if your kids, you always want to go to your doctor, to have a good evaluation. And so a new kitten, we want to check them out. We look at their eyes, their ears, listen to their heart. We're going to check to make sure they're correct sex. Oftentimes people think their cat is a male cat and it's a female cat. I just had that happen like last week. So it can be difficult to sex kittens. So we'll get the sex straight for you. Other important things are parasites, where there's a life cycle of some parasites that oftentimes, even if you get a new kitten, they might have been dewormed at least once. But the life cycle of the parasite, sometimes there's just got exposed to them and it has to get maybe a couple of weeks to the parasite to mature just a little bit, so where we can kill those parasites with the dewormer. So usually we're deworming them several times, and almost each visit they're coming in with the vet visit.
I'm so glad that you brought that up, because I think something that can be surprising to people is, as organizations, we do as much as we can. And I always say, like, a healthy kitten is a healthy kitten today. It doesn't, things can change in kittens' bodies very quickly. And that's absolutely true when it comes to parasites. You deworm a kitten, but it's not like one or even maybe 2 times is a guarantee that they're not going to have something else come up. And then, of course, when people say, this kitten was dewormed, that would not necessarily cover the full spectrum of all the parasites that they might have.
Exactly. Right? People think they may just have worms, but we have other parasites that are not worms that we're looking for in the stool samples. So there are coccidia and giardia. Those can cause, vomiting and diarrhea, and they're very easily treatable. A lot of these things, these parasites are so easily treatable. And the other issue is people can sometimes pick up some versions of these parasites too. Not so much adults, but children seem to be a little more prone to that. So, and kids, they really want to get the kitten in their face, and so, you don't want to risk people getting those parasites too, especially kids.
Yeah, so that's another great reason that, even if you're getting a kitten from a very reputable organization, they've vaccinated them, they've dewormed them, there might still be some responsibility on your part to finish that cycle. Can you talk then about, a lot of people adopt a kitten from a shelter or a rescue, but some people adopt a kitten that they've found in an alley, right? I mean, I think a lot of us have done that. I've certainly done that, found a kitten outside and adopt them. And these kittens have no health history, nothing at all. So for people who are taking in a kitten that has never seen a vet, what are the types of things you're doing with that kitten? Or, how many times should somebody be coming in and seeing a vet for a kitten that they rescued off the street?
Sure. So, if they're just rescuing, it also depends on the age, of the kitten. So, if they are, tiny little kitten, a few weeks old or so, then they might need bottle feeding, which that can be difficult for a lot of people to do correctly. If they are eating solid food, then they're a lot easier to take care of. And what we're watching for with these ones that are, just found is, do they come with parasites, which is a common scenario because they've been out and about, and parasites actually get passed through the mother's milk. So that's how they get them often. And they might have other parasites like fleas, ear mites. These are fairly common things. And then respiratory infections are very common in kittens. Think of it as a cold, a cat cold. They're typically viruses, and they can vary in severity from, a mild little sniffle or a little sneeze to pneumonia, and they can get really sick. And we're trying to prevent these things with vaccines. Another important thing is when you're finding a kitten, a lot of times a mother cat might be lurking around, so sometimes it takes just a little being patient, and seeing, is this kitten crying? Is it underweight? Does it look sickly, or does it look healthy and happy? It may have a mother cat somewhere. So sometimes it takes a good, a few hours to a half a day or so to kind of, watch and see, is it in a safe place? And does the mother cat come back for the kitten?
Mm-hmm. Mm-hmm. Yeah. So even more important, if you have found a kitten outside, I would say, as somebody who takes in kittens directly from the street, it would be a miracle to get a kitten who doesn't have something going on that they need veterinary assistance with, whether that's
right.
Ear
Yeah, they can be underweight, parasites, the respiratory symptoms and diarrhea, are very common, with little kittens, and getting on a good diet too, is important.
Well, let's talk about respiratory issues for a moment, because that is so common. And, I think sometimes people think of, themselves, and if I get a sniffly nose, no big deal, I can still, go about my day. But for kittens, there can be kind of a cascading effects of having like a stuffed up nose or inability to, breathe very well. Why do kittens get respiratory issues so commonly? Like what is the reason that you see that more in a kitten than in an adult cat? And what is the risk of letting something like that go untreated?
It really is because their immune systems are not mature. They just, again, just like, for example, like kids, think of kids, they pick up all those infections very easily, human children. And so, the babies are just, their immune systems are not mature. It's so easy to pick those things up. And it's not just one virus, it's a few viruses that all act fairly similar with respiratory symptoms. And you might see eye discharge, you might see sneezing, you might see coughing, and then, severe symptoms could be pneumonia. And even if kittens have, they really, cats in general and kittens are driven by smell of their food. And so if they get a little stuffed up nose, they don't want to eat, and they can get dehydrated, and, and that spirals into a worse, scenario. So just some first aid, basic, treatment of symptoms, like keeping their nose clean and make sure, the food is nice and stinky, warm it up some, make sure they eat it, to help keep them happy and healthy.
Yeah. And I think it's important, I hear people say sometimes, well, I just, I'm using a hot, steamy shower to help keep their respiratory tract open, which I think is definitely one tool. But there is a certain point at which veterinary intervention is absolutely necessary, right? So how would you help somebody understand when it's something they can kind of manage at home versus when they really do need to go to a vet for a respiratory issue?
So oftentimes, people are not sure, and most all veterinarians, we can triage that over the phone. We can ask you some basic questions, hey, is your kitten eating? Okay. If it's not eating, maybe you need to bring it to the vet, because they don't have a lot of body reserves. They get dehydrated. They can get low in their blood sugar, which is another important thing. So if they're not eating, needs to go to the vet. If they're having trouble breathing, if it looks like they're kind of sitting hunched up and breathing kind of heavy, okay, that's another symptom. Hey, you need to bring it to the vet. And then they will also get fevers with these infections sometimes. And, symptoms of a fever would be basically lethargy. They feel kind of down. They, don't want to play. Kittens, if they're healthy and happy, they should be playful. They should be sleeping a lot. They should be eating multiple times a day, like 3 to 5 times a day, depending on the age. And shouldn't be crying. If you hear a kitten crying too, something's not right. They're too cold, they're hungry, something's bothering them. And they will cry occasionally just, if they first see you and they, get excited, but, if they don't seem like they can calm down, you might want to get them over to the vet.
Sure. And what about eye issues? Like, why do you see, I feel like every kitten gets at some point crusty eyes. How do you help people understand the difference between like just a little bit of, post-sleep crust in their eye versus something that might need like an ophthalmic antibiotic or something like that?
Sure. So the important things when I want to see a cat or a kitten or any animal for their eye issue is if they are winking the eye, like, ooh, it really hurts. If the eye looks red, and the red part would be, you got to pull up the eyelid and look at the white of the eye, compare it to the other eye. If the white of the eye's pretty white on both eyes, okay, we're probably not as serious an issue. And then any cloudiness or discoloration of the eye, those are really important indicators. Discharge can be maybe not so serious. So if you get like a little goopy stuff in the eye, as long as those other things aren't happening, winking, the redness of the eye, or any cloudiness in the eye, might not be as serious. But those first three things, yes, bring them into the vet so we can see that. Those are also important because of the viruses that they get. The viruses that affect the respiratory system also affect the eyes and the conjunctiva, the lining of the eye. So that's why we see a lot of those things. They're all tied together with the respiratory stuff.
And I love what you said about triaging over the phone. I think that's such a good thing for people to know, that like you can just make a call and ask, do I need to come in or do I not need to come in? And I think that's helpful for the adopter, but also for the vet, right?
Sure. Yeah. Because eyes especially, they can get bad really quickly, or they can get better really quickly. And like we've seen with some of your little orphan kittens, some of them you don't get them until, oh my gosh, that is like maybe not good for future vision. Like maybe their eyes are not going to function normally. So you got to be on top of eye issues early to make sure they preserve vision and have healthy eyes.
Sure, absolutely. And then the other thing you mentioned that you see a lot is GI issues. We did talk about parasites a bit, but there are other reasons that a kitten might be having a GI issue. I am very, very passionate about kitten poop and making sure that kittens have good poop. And I think a lot of people make this assumption that, well, a lot of kittens have diarrhea, so like no big deal. They'll probably get over it on their own. Can you kind of talk about that myth a little bit, that like it's okay if kittens just have diarrhea?
Yeah, so I mean, it's one of our important indicators for animal health in general. We typically ask about vomiting, diarrhea, coughing, sneezing. Those are our basic four. If your animal is doing those things, we need to look into it and get that corrected. And kittens, they don't have, again, going back to their body reserves, they're super tiny. They don't have very many body reserves. If they're having diarrhea, they can get rapidly dehydrated and low in their blood sugar. And they might have to get hospitalized to correct something like that. So if we can get on top of that early, we can avoid more serious complications, developing. So yeah, little babies, they shouldn't have diarrhea. We need to correct that. And it goes back to checking for parasites, making sure they're on a correct diet, and making sure they don't have something wrong with how they were formed. There are some congenital disorders, like something they were born with that's not correct, in their digestive tract. At the Humane Society, we've even had a couple of kittens that didn't have an opening out of their anus, and if that's correctable. But
and people don't realize that. I've had a couple myself, and I never knew before having one that was even a possibility. But there are, like you said, a number of congenital issues that can come up with kittens that is a great reason, especially if you're an adopter, to go to a veterinarian, because if you're not used to looking at kitten anatomy or understanding what is normal for a kitten, you know, a veterinarian can very quickly say, something seems wrong, you know, do whatever diagnostics are necessary to determine if there could be something congenitally.
And that first visit with that physical exam is so important. You know, we're doing a nose to tail exam. We're going to be checking over, you know, all the basic systems and making sure they weren't born with something abnormal, make sure we're preventing diseases and making sure they're, you know, protected, you know, from everything in the future and get them on a good first start.
So you mentioned the importance of diet, and I think a lot of people don't realize that there's not just like cat food. There's like cat food for all different life stages, including for kittens. Can you talk about why somebody should consider putting their kitten on a diet that's actually for kittens, and like what do kittens nutritionally need that is different than a different life stage?
Yeah, they are growing so quickly. And so their bones and their muscles, they're just growing so fast. And they need extra calories, you know, so the food needs to be more dense so they can grow quickly. And they need those extra minerals to kind of help those things to grow. So they need more calcium. Those bones are growing so fast. They need that calcium. And that calcium and phosphorus really has to be in the correct balance. You know, feeding a kitten an adult cat food doesn't help as well as a kitten food, which is designed for growth. And then feeding kitten foods to an adult cat is a little too rich. You know, they're going to have some weight gain and some, you know, mostly the weight gain is the biggest issue. You know, it's very rich, and maybe diarrhea with how rich that food is. But the kittens, they need it. They need to grow. Yeah. It's like putting fertilizer on your plants.
Yeah, sure. Well, and I can say, you know, you can tell that kitten food is full of good stuff because my cats envy it so much. Every time they see the kitten food, they're like, let me have some of that. I'm like, you do not need food that is formulated for a kitten. But kittens really do.
And they're benefit. Yeah. And they're coming off of nursing, you know, from their mother, which, you know, the milk is high in calcium and fats and, you know, proteins, you know, so they're transitioning from, you know, all that they need from their mother to, okay, now we need to replace that with solid food in that similar situation. So super important.
Yeah. I'm a big fan of kitten diets. I want to talk to you about something that this was like the most exciting thing for me to talk to you about because I consider you like an incredible expert at this, which is spaying and neutering. For anyone watching this, Dr. Cammarata does all of our spays and neuters, and I've never seen such beautiful surgeries in my life. We just love the surgeries. You do so much, and you know, for the kittens in my rescue, we're doing their surgeries right around 2 pounds, shortly after 2 months usually. And sometimes people are surprised by that. But you do a ton of this for us, for other rescues, for the Humane Society. I was wondering if you can talk a little bit about kind of these younger spay neuters that you do for rescues. Why is that done? And what is your experience with that? Like, what is the benefit for the animal and for animals generally when we're spaying and neutering at that age?
At that young age. Yeah, so you know, so I never used to do those when I was in private practice. We kind of waited until we got through all their vaccines, and then we, you know, went and spayed or neutered them. But working at the Humane Society, the goal is to not, you know, let those animals that leave the shelter to reproduce. Okay, we don't want to see more animals come back to the shelter. And so spaying and neutering them, you know, when they're ready to just be adopted is the goal. And so we don't adopt them out until they've been spayed or neutered, which happens at that, they have to be a certain size. At 6 to 8 weeks is when we'll do it. But we have to be much more careful with these little tiny kittens because anesthesia kind of lowers body temperature, affects their blood sugar. So we need to be quick. You know, we need to do these spays super fast, and we need to, you know, have the anesthesia last only. I'll do a kitten spay in like 5 or 6 minutes. You know, and then, we recover them, we give a reversal of the anesthesia, and they're up and around, and they're playing in their cage after they've been spayed because
Mhm.
the incision sites are super tiny, like
So small.
maybe a quarter inch or so, and so they don't even hardly recognize, I think, that they had a surgery done because there's not a lot of cutting and things, and think of it like laparoscopic, where we
Hmm.
can do laparoscopic surgeries on people. This is the laparoscopic size spay and neuters,
Hmm.
and so the kittens, they bounce back so quick. When we're
Hmm.
doing more older kitten spays and neuters, the surgery takes a little longer, and there's a little more body fat. It takes, it's a little harder surgery. In these tiny little guys, as long as you have someone who is good at doing them, it is like I actually prefer them because they're bouncing back, super fast. They're playing in their cage like an hour later and
Sure. That was
eating
one of the
and
things I wanted to ask you was about recovery times and also like complications. Like if you see, because I would guess based on my personal experience, which of course is limited to young kittens, I would guess that you would see fewer complications and faster recovery because the kittens that we get, I
yes,
mean, they come home and they're like, oh, did something happen? And it's
right,
like, you're
yeah,
supposed to be resting. And they're like, no, I'm climbing the cat tree. Like, I'm fine.
yeah,
And we have
sure.
so few issues after spay or neuter.
Sure. So the older cats are one of the complications is pestering the surgery site. Because little tiny kittens, they're not so coordinated. They're just learning how to groom, so they're a little goofy about it. It's hard for them to pester a surgery site, and then they're sleeping a lot. They're kittens, they're babies, they're sleeping a lot. Whereas you have like a young adult, they're running around, they're jumping off the furniture. These little babies, they barely can get up on the couch, let alone on the top of the dresser, jumping
Hmm.
down.
Hmm.
So, yeah, the bigger guys are just, they're very active and, they're going to pester that site. And the little
Hmm.
babies, they heal up just so quick, Yeah, they're
Yeah.
so easy.
Yeah. I wanted to ask you about like post surgical recommendations because oftentimes I'll post a photo of a kitten and say, oh, she just got her spay, she's doing great, and I'll get 1,000 comments. Where's her cone? Why isn't she wearing a cone? And
Hmm.
we almost never need cones for ours, but I wonder if it is because of their age and because of the incision size, and they
Right,
just.
because the surgery site, there's no external stitches. Okay, there's nothing for them to really pester at either. So even my adult spays, I don't, I'll send home a collar, but it's hard for them to do much to that site. The whole reason for the e-collar is so they don't pester it. But when you have an incision site that's super tiny and no stitches on the outside, they don't even know where to bother themselves because they don't even know it's there.
Hmm.
So we don't I don't usually, and in male cats even, it's not an abdominal incision, so they don't really have anything to pester either.
Yeah.
So the incision site's so tiny. Why animals will pester surgery sites is because of pain or irritation, and
Hmm.
or they feel something that shouldn't be there. So that would be the external stitches, or a larger surgery site might be uncomfortable, so they're going to
Hmm.
pester. When you get down to these micro surgeries, they don't even recognize something happened. So you don't really need a lot of protection from that. And there's not much they can damage. There's no stitches on the outside.
Yeah. Yeah, and I think it should be said that every practice is going to do spays and neuters a little bit differently. So
For
um,
sure.
the
Yeah,
post-surgical recommendations that you give might be different than another clinic because another clinic is doing the
exactly.
surgery in a different way. But I
Right.
certainly feel
And
very,
most
very
clinics aren't,
fortunate that ours are
yeah,
so simple.
right. And most clinics aren't doing these little tiny babies. They just don't have vets who have that experience where I've done literally thousands, of little tiny babies, kittens less than 2 pounds.
Sure, it
Um,
shows. It's amazing.
yeah,
We're
yeah,
so lucky to
yeah,
have you.
yeah,
Um,
yeah.
I want to ask you one more question about, you work with cats of all ages, and probably better than anyone that cats sometimes don't love going to the vet. Sorry.
Hmm.
They can have a difficult time on the car ride or in the carrier or with some
I
of the
think of it kind of
procedures.
like an alien abduction,
Sure, yeah.
because
So,
they're like, wow, what is going on,
sure.
Yeah.
But with a kitten, kittens are kind of a blank canvas. Like, they don't know what's going
Hmm.
on. You take them somewhere new and they're like, oh, wow, what's this? Okay, cool.
Hmm.
What recommendations do you have for new adopters who want to do things that are going to make vet care easier later on?
Hmm. So there's quite a few things that can be done. So one is kind of doing some of the things that the vet might do in the office with touching. Okay, so like looking in the ears, looking in the
Mm,
mouth, looking at the teeth, feeling them, and looking under their tail, checking their toes. All that
mm,
handling that it's not a shocker that oh my gosh the vet's touching me places where my people don't touch me.
mhm,
So the touch, and then the container or the crate or however they're going to be bringing the cat into the vet office, it should be a familiar something. So a lot of times, if someone is adopting a pet, they get a crate or something along that time. But also, if not, get a crate. And you can leave it out. And you can put treats or you can put toys, and they'll go in there. And sometimes they'll like to kind of just even sit in it. Cats love boxes.
mhm,
They just love it. So getting them used to being carried in something to the vet. And
mhm,
then, we have them coming in frequently as kittens. So hopefully we're establishing that, it's not too scary of a thing. But, if they're a little hesitant, a lot of veterinarians and veterinary offices will, offer to just have like a social visit, if you just want
mm,
to come in. To help that out. So you just come in and you just have us give some treats, and then, okay, that's it. It wasn't a scary visit, and
yeah.
then they got the whole car ride, the whole crate, and that experience and, realize, hey, it's not so bad.
Mhm,
But, the goal is not to make a fearful experience at the vet as best we can. We're trying to avoid as best we can stressful events at the vet because then that's what they'll remember the most is, the
mhm,
stressful event.
mhm. Yeah, and there are things that will be beneficial to their health later on that you can start doing as a kitten, things like trimming their nails regularly. What about toothbrushing? Is that something you recommend for kittens?
Yeah, that's if you can get in the habit, it is so beneficial. Okay, to tell you the truth, most people,
It's
are
hard.
don't get into the habit. It's hard. Everybody's busy, but if you can start them young, okay, nail trimming, brushing the teeth, brushing their hair, and experiencing a bath or two while they're a kitten because these can be quite difficult in a more adult animal when they've never had it happen before.
Sure.
There's a window of up to about maybe 3 or 4 months where if they experience a lot of these things, it's not scary later on in life. But
Mhm.
what happens is sometimes things don't get thought of until they're more of an adult, and then it's more traumatic for them. They just get hardwired at a certain point, whereas
Mhm.
they're kind of soft wired early on, and you can train them a
Sure.
lot easier. So practice that nail trimming, even if it doesn't need to be done. Practice that teeth brushing, even though it's not needing to be done at that young age because all their baby teeth are going to fall out. But it's more, maybe a couple once or twice a week, even just to kind of practice it to get them,
Mhm.
used to it. And
Mhm.
if you got in the habit with your older cat, it only takes a few minutes to do the brushing, of
Mhm.
the teeth.
Mhm.
So it really helps to slow that tartar buildup.
Yeah, well, kittens definitely are malleable. My little kitten Ferguson, who
Mm-hmm.
he has been poked and prodded and given medication for his entire life, and now he actually thinks it's like a treat, and he he like gets excited for medication, and
Yeah.
he's doing so well now that like we're a lot of his medication has decreased, but he's like looking at me like, "Come on, aren't we gonna do medicine?"
Sure. And you can always tell these like kittens that were like bottle fed orphans that were kept in little groups, for good socialization, especially at like the Humane Society where they have a whole kitten nursery, of hundreds of
Mhm.
kittens that they've had all of these things done already. And if you
Mhm.
can ever get, one of these kittens from like a rescue like that, like your rescue, or Humane Society's nursery, these kittens are the most docile, pets, really make great pets for kids because they've been handled so much, being the bottle fed, having their little bottoms wiped, and medicating, they've had it all done already. So such great pets.
Well, thank you. And, I think that rescues and vets working together is a magical thing. And I'm so grateful for the work that you do with our kittens and the wonderful services that you provide to them. And I'm really grateful you could share with me today. So thank you. Yeah, I'm sure. I mean, bringing kittens to you is probably fun and cute too, but not that you don't see them.
All the staff, because we don't get to see that many babies like that. And all our staff just kind of oohs and ahs and has to snuggle with all your little babies.
Well, I'm sure the kittens like it too. Well, thank you so very much. It's been wonderful talking with you. I really appreciate you. And we'll see you next time at the clinic.
All right. Sounds good. Okay. Have a good morning.
Thank you so very much. Well, thank you everybody for watching. I want to again thank Royal Canin for partnering with me on the Cat to Vet series, as well as the Take Your Cat to the Vet initiative. Please check out their website. You can learn so much more. It's royalcanin.com/cat health. You guys, I've had so much fun doing all of this. Please stay curious about your cats, stay compassionate, and don't forget, you can find this entire series at kittenlady.org/catology. Thank you guys so much for watching. Bye-bye.